What is measurement-based care, and why is it important for a mental health practice?
Measurement-based care means trying to get appropriate measures to track what you're treating in whatever healthcare industry you're in so that you can assure that that treatment is going well. And there are a lot of unique challenges in the field of mental health that we've hinted at before. The main one being that a lot of measures of outcomes in mental health are subjective. So we don't have a blood test, we don't have imaging. We do have some objective things like trips to the emergency room for psychiatric issues, or for kids, days of missed school, without a doctor's note, that are objective on some level. But we've struggled for a long time, and you've worked on this with me over going back many years, that we really need to do better at establishing measurement-based care in mental health. And this is really what I feel could revolutionize the entire field, and which is why we have spent so much time at RipsyTech thinking about this process, how it's evolved from what I used to do when I started almost 20 years ago to what I think we're at now, and thinking about how to make it even easier in the future. I think that's a long-winded answer to the first part of what is measurement-based care. The second part of your question was, why is it important for mental health practices? Mm-hmm. In pure honesty, the reason it's important right now is so that patients and the providers can see clearly who's getting better and who isn't. That is why this is important. The other piece within here, which although it's talked about a lot, in all honesty, I don't see it as a reality yet, is that we're trying to, insurance companies and other systems of government want to see more definitive proof of good outcomes in care. This is talked about all the time. I think if you look at any of the new mental health startup websites, they're all about measurement-based care, evidence-based practice. Mm-hmm. The reality is the demand for mental health services so outweighs the supply that in those scenarios, it's not so much about good outcomes or measurement-based care yet, but hopefully we are headed in that direction.
So would you say it's, instead of it being about good outcomes and good measurement-based care, it's just been about providing care?
That is what the field is about and still is about, even though you see allusions to evidence-based practices, better outcomes, et cetera. We're just not there yet.